Hi, welcome back to my channel, Time with Dr. Adams. Please, if you haven't subscribed, do so. Today we are talking about yeast infection. Yes, it's a common infection. Studies have shown that every woman will have this infection at least once in their lifetime. So stick around if you want to learn more. Don't forget to subscribe. Time with Dr. Adams. Hi there, welcome to another episode of Time with Dr. Adams. Today we're talking about yeast infections. Yes, candida infection, probably white. People also call it white. Yes, it's very common, and there are different ways of treating it. Now let's talk about what it actually is. It's a fungal infection. When we talk about yeast infection, it is a fungal infection, which studies have shown that most women actually do carry this fungus in its minimal amount. The fungus that causes this is from the Candida species. There are lots of them in the species, but the most common one is the Candida albicans. All right, and studies have shown that in our vaginas as women, we have it in a small amount. When there is a problem or when the pH system of the vagina changes through something you might have done or something you might have taken, boom, it lowers the protective mechanism of the vagina, and this yeast grows. Imagine when you are baking bread, yeah, we add yeast to it, we cover it, and then by the time it's risen, right? Yeah, that's how it works. So if the good bacteria or the good flora in the vagina goes down, the flora, which was at the same level, so this one, the good one, goes down, then the yeast starts growing, and boom, you get a vaginal or a yeast infection. So we've spoken about the fact that it's caused by a fungus. And who are those susceptible to getting it most often? Everyone can get it. Sometimes you haven't really done anything. The body itself is tired. You're under stress. You are not eating well. You are traveling. You haven't taken your bath, or personal hygiene is down. Boom, that can happen. People who abuse antibiotics. Yes, we cannot overemphasize the need for you to understand that abusing antibiotics can cause you a whole lot. Like I explained, good bacteria goes down, then this fungus grows. So if you're abusing antibiotics, the antibiotics will go there and kill both good bacteria and bad bacteria, and the fungus will flourish. All right. People who have conditions such as diabetes or even HIV, anything that will compromise your immune system will let this fungus grow. All right. One thing I want you to understand, that yeast infection, candidiasis, isn't a sexually transmitted infection. I repeat, it's not a sexually transmitted infection. Okay, so it can easily be treated. Now let's talk about the signs and symptoms. Itching. It's very itchy. I'm not saying anytime you feel your vulva itching, it means you have a fungal infection. No. Usually people will come to the hospital and say, I have an itch in my vagina. We've spoken about this. The vagina is a tube. What you are calling an itch in your vagina is usually an itch on your vulva. Okay, so you will have the vulva itching, and then usually you might be in town hall, you might be at work, and you might be doing like this, trying to scratch it with your legs. You're trying to cause friction, right? Cause friction there so that you can scratch it. You don't want to use your fingers, especially when you are in public. And then when you are home, you scratch it. So itch. And because we scratch it too much, it will cause soreness around that side. Now, the soreness can be very painful. Usually when you come to the hospital, you tell the doctor that when I wee, I feel pain in my vagina. Usually it's not pain in the vagina, it's pain around the lips of the vulva, because that is where you were scratching. So that's where that part will become sore. So we've spoken about itching, we've spoken about soreness, and then we will also speak about, because there is soreness, you will have what we call dysuria, when you wee, and then the urine gets into that part that is sore. If you don't take care, you will quickly say that you have a UTI, a urinary tract infection, because anytime wee comes out, you feel that pain. But you see how it's following. There's an itch, you scratch, then that place becomes sore. The lips of your vulva become sore. And then when you wee-wee, it goes in there and becomes painful. All right. And then we also have painful sexual intercourse, because that whole area is painful or has become sore. Immediately the penis enters the vagina. It's a superficial dyspareunia. That's painful sexual intercourse. All right. And then we also have people who will not have any symptoms at all. None at all, apart from maybe small discharge. So going forward, we also have people who will have plenty discharge, and that is where the name is coming from, white, because usually either you are not seeing any discharge, or the discharge that is coming out is a bit whitish, or is looking like custard, cuddy. The secretions become a bit lumpy or come together in lumps. All right, so we have those without discharges. They might have the other symptoms that I've mentioned. We have people who will have the whitest discharge, and we will have whitest discharge with or without some of the symptoms we've mentioned, and we'll have people who have that creamish or curdy-like looking discharge. With all this, you can treat with over-the-counter medications. With over-the-counter medications, we have 3 types. We have the tablets. Usually it's taken as a single dose, or if your kind of infection is a bit chronic, your doctor might prolong the number of days, but usually it's just a single dose. We also have what we call the pessaries. The pessaries comes in this form, and you are asked to insert into your vagina. Some of them come with a rod-like object. You put it on top, and when you stick it up in your vagina, it pushes it in. So we have the tablets, usually a single dose. We have the pessaries, and we have the creams. The creams also comes in 2. The ones that you apply just on the vulva, or you'll be asked to apply inside your vagina, whichever one you buy over-the-counter drug or over-the-counter medication. Please ask your pharmacist to explain to you very well. I've seen people who have actually swallowed pessaries because they did not understand that the pessaries go into their vaginas. They went home and swallowed it. Please do well to ask your pharmacist or your health worker how to use that medication. If you bought an over-the-counter medication and it's still not working, please go see your nearest doctor. Be helped. Yeast infection is common, and do not feel shy. I know people come to the hospital and they are shy to talk about their symptoms because they feel maybe you're going to say they didn't do something right, personal hygiene. It can be all the causes, but whatever it is your vagina, and your vagina needs to stay healthy. So please come and let's help you out. Do not forget to eat a balanced diet. Drink loads of water. Water is so helpful to all of us. It will help with keeping the place not dehydrated and moisturize, help with the production of your secretions as well. Do not abuse antibiotics. You can eat lots of Greek yogurt. I usually tell my patients this because I have personally realized its use in my clinical life as well, telling patients what to do. It helped them. Okay, and do not go inserting things in the spices or things that have not been prescribed by your doctor in the hospital. Don't forget to douche. Douche is just when people apply high pressure water in there. Don't do that. We've spoken about how to wash the vagina, which usually is not our vagina, but then our vulva. Keep it clean, keep it healthy. Let me know in the comment section below what you do to help your vagina stay healthy. Thank you for watching. Please do not forget to subscribe. Bye. Time with Dr.